Doctor on Demand, where we've been, where we are today, and where we hope to be in the future. And then I want to talk about what we've learned about where patients are spending their time, how they're making decisions, and how we're sort of setting up a foundation for using telemedicine to treat chronic diseases. So Doctor on Demand is a video telemedicine company, and let me tell you a little bit about us. So we were founded in 2012, and at that time our goal was to become a video telemedicine company. And at the time when we only had really the CEO and just a handful of engineers, we did a lot of research into telemedicine and wanted to see, what that marketplace was like. And what we learned, interestingly, was that employers, actually, companies, knew what telemedicine was, and telemedicine had been around for at least 10 to 12 years with companies like Teladoc and American Well and MD Live. And what we noticed was that while many large companies were actually offering telemedicine as a medical benefit, the utilization and the patient engagement was very, very low. And we studied that to see why that was. And what we learned was that the engagement was low. These were mostly telephone-based models that required a callback. Usually within about 20 to 30 minutes, you would receive a call back from maybe an RN or an MD. And the patient experience of making this phone call and talking to a call center was really suboptimal. So what we decided to do in 2013, when we launched nationally, was that we were going to do so with consumers first. And that meant hiring and training thousands of board-certified physicians all across the country, and we decided to launch to consumers because we wanted consumers to tell us through their behavior, through every click, swipe, tap, and interaction that they had with our app, what was working and what wasn't. And with that, we were able to very quickly make changes to our app to make sure that we were serving patients in the best way that we could. And at that time, we actually quickly rose to become one of the top-rated medical apps in the app stores. So then in 2014, after having fully tested the app and the service with consumers, we took the service into the employer space, where we started to talk to really any Fortune 1000 company that would talk to us. One of our first customers was Comcast, with about 200,000 employees and dependents. And so we rolled out the service there with a focus on looking at the patient feedback, looking at the reviews that they were leaving for us in the app stores. And then what we also did was we went beyond urgent care. So up through that point, our board-certified internists and emergency medicine doctors and pediatricians were treating a full range of urgent care issues like coughs, colds, flus, rashes, GI issues, and things like that. And at that time, we then decided to add a full suite of PhD level psychologists, and we're then started treating mental health through our practice. In 2015 was when we scaled our business both to consumers and employers, and in that year, we actually, the growth of our employer business was really exploded, and we signed up over 400 large employers, including 4 of the Fortune 10. So some of the largest companies in the country were now working with us, and we had the privilege of serving those employees and their dependents. We also started working with health insurance companies like United Healthcare, Humana, many of the Blue Cross Blue Shield plans. And we always remained true to why we got into this business to begin with, was to serve the patients. And so we took the best learnings that we could through our Silicon Valley DNA, our focus on that patient experience, and putting together a clinical program that we felt was unrivaled in the business. So today, while we treat a full suite of urgent care issues, and we now also, in addition to our PhD level psychologists, we also have a full panel of psychiatrists as well. Where we really feel the power of telemedicine is in the treatment of chronic diseases. And the basis of that is our employed provider network, and I'll talk a little bit more about that in a minute. we will be launching the capability to prescribe and integrate with the lab companies like Quest and LabCorp. And we have the ability to be connected to wireless health devices such as CellScope's otoscope and ClinicCloud's wireless stethoscope and glucometers and devices like that. So anything that really helps to empower our providers with objective data to help them make better treatment decisions, that's really where we want to be headed. So we wanted to, before we actually launched our service, we thought a lot about where patients were spending their time, because we really knew that we couldn't ask patients to adapt to our technology. It really had to be the other way around. So we wanted to learn about, where are they spending their time? And the reality is it's in mobile. And so the data that you're seeing here is the growth in time that patients or people are spending using their mobile devices between 2014 and 2015. And you'll see that there's a 35% increase in the time that they're spending using their mobile phones and tablets. And so we knew that our first product had to be mobile ready. And so in fact, we are a mobile first company. That means the first product that we offered to patients was through iOS and Android. And it wasn't even until about 6 to 8 months later that we actually developed a version for the desktop. And the reality is this is how patients are engaging with us. The majority of the video visits that we do is through mobile. And then we really wanted to know how patients are making decisions. And we really leave it up to their reviews. We know that in other parts of their life, patients are making decisions based on referrals and recommendations, especially online reviews, whether it's through Yelp or Amazon or any other consumer platform. And so we looked to the App Store and Google Play to understand where patients were having success with our app, where they were struggling, and it really helped to inform the changes that we were making to our product and our roadmap. Now, when I think about the role of telemedicine in chronic care, there are 3 things that I feel are extremely important in order to do this in a responsible way. Because our goal at Doctor on Demand is to make sure that we practice telemedicine in the most clinically responsible and safe way possible. And in order to do that, we have to make sure that we're mimicking an in-person visit as best we can. The first way to do that is the visits have to be done through video. There's a number of telemedicine companies out there that will do telephone-based treatment. And we believe that in order to be responsible, patients have to be able to see, interact with their providers and vice versa. You have to have telemedicine specialists. And what I mean by that is that we believe that telemedicine is a specialty in and of itself. So just as physicians go on to do fellowships in endocrinology and gastroenterology and surgery, we feel the same way about telemedicine. It's not intuitive to every physician, bedside manner, how to do an effective physical exam through video, how to make that connection with patients. And so we build that right into our practice. We believe in evidence-based telemedicine, and we take our providers through that telemedicine specific training where we've developed clinical guidelines that are written specifically for telemedicine. We take them through that training before they're even launched onto our service. And a comment about our providers. These are actually employed providers. They're W-2 employees of our company. There are lots of models where companies will sort of treat their providers as kind of a call center, so that whatever patient call comes in, they'll hook up that patient with the first available provider, whether that provider is sort of on the street walking his or her dog or in the hospital rounding on patients. We don't believe in that model. Our physicians sign up for shifts with us. They are dedicated to our patients for the duration of their shift. They are stakeholders in our business, and we believe that sets up really a model where they're set up to develop some very strong relationships with patients, which is really the basis for chronic disease management.